Hello everybody, welcome to my YouTube channel. My name is Shiva Ravindra. Today I am going to discuss 50 clinical trial endpoints. Okay, so any clinical trial, so we are doing some clinical trial in the sense, so we need some endpoint and primary and secondary and exploratory objectives are there. So what are the objective related endpoint? So 50 types of clinical trials we are going to discuss in this video. Okay. So before that one, so what is p-value? So p-value is nothing but the probability value that the observed difference happen by the random chance. So if your p-value getting less than 0.05, so that means we have a significant difference there between the both the treatment, and so the first treatment is better than second or second treatment better than first, we can find out. If your p-value is greater than 0.05, that means there is no much difference, significant difference is there. Might be difference there, but there is no significant difference not there within the two drugs. Okay. So here what is efficacy? How good the drug control the disease, responses, survival, etc. How what is the safety? How safe the drug is, like side effect, organ damage, etc. So p-value, so probability value provides the difference between the realigned not by the accident. And here some of the safety endpoints. So first one is adverse event rate. So adverse event rate, the definition is if any study having the endpoint is adverse event rate, that means what? Percentage of patient experienced any side effect. For example, drug A has 25% nausea, related nausea nothing but sensation of the vomiting. So 10% had who are taking the B drug had nausea. So the if you are getting the p-value 0.01, the B drug is more significant and safer than the drug A. In case of second endpoint is serious adverse events causing the death, hospitalization, or a disability. So ICU administration, like drug A has 5%, drug B has 2%. That means drug B has fewer serious adverse event and it is more effective than the drug A. So if you are getting the 0.05 less than only, then only we can say that it is a more better than the A drug. Okay. So third endpoint is treatment emergent A is new side effect appearing after the drug start. So for example, rash in drug A 15%, drug B 8%. So if you are getting the p-value 0.03, B drug has in a fewer treatment emergent AEs compared to the A drug. So organ toxicity, drug-induced damage to the organs, liver, kidney, or heart. Whenever we are doing some clinical trial due to the drug, so any organ damage was happen, organ toxicity was happening. So liver toxicity, drug A has 12%, drug B has 4%. If you get the result like this, and the p-value 0.005, so B drug has a more safer. So the final conclusion is like that. Lab abnormalities, unusual blood or lab test results due to the using of clinical trial. So for example, blood sugar ranges were going high 30% by using the drug A and 12% only drug using the B. So B drug is the safer if you get the p-value less than 0.05. Okay. So efficacy endpoints. So most of the clinical trials are doing to get how the efficiency of the drug. So some efficacy endpoint. So first one is overall survival. The name itself showing overall survival. The time from the patient starting the treatment to the until the death. Okay. So drug A 16 months the subject is alive. Drug B 20 months the subject is alive on an average. So 0.02 you're getting, drug B is a safer drug. Progression free survival, time from the disease version or death. Treatment taken to the disease version or death, whichever occur first, that duration we calculated. So drug A has 6 months, drug B has 9 months means drug B delay the progression. So it is a more effective. So disease free survival. So time remaining totally disease free after treatment. So sometimes what happen after completion of the tumor, then again it will regenerated the tumor. So that duration we calculated. So drug A has 70%, drug B has 80%, drug B prevent more relapse better. Time to progression. So time until the disease show any progression. So A drug 5 months, B drug 8 months, B drug tumor regrowth delay. So that is why B drug has this, more efficient than the A drug. And response rate, percentage of the patient whose tumor shrink. Drug A has 45% response, drug B has 65%. So drug B is more effective. So complete response, tumor completely disappeared from the body. So A drug has 80%, B drug has 15. So 15 B drug is a more efficiently remove the tumor from the body. Partial responses. So if it is 70% decrease the size, so we can consider as a partial response. So that type of response, 30% for the A drug, 45% for the B drug. So B drug has a better shrinkage. Duration of response. How long tumor stray shrink after the response. So A drug has 5 months, B drug has 10 months. B drug has a longer lasting response. And tumor reduction, percentage of the decreased size tumor after the treatment. So 25% A drug, 50% B drug. B drug has a more shrinkage property, so it is a better drug. Clinical benefit rate. So percentage with the complete response plus partial response plus stable disease. Okay, these three responses percentages have A drug has 60, B drug has 80. So it has a 0.07 you will get. B drug has a benefit, but if it is not a 0.05, but there is no much significant, but it's better. Okay. Yeah, pharmacokinetic related endpoints are like Cmax, so highest concentration of the drug in the body. So A has 5 microgram per ml, B has 8 microgram per ml. So we can check which one have a maximum concentration. So AUC, area under the curve, total exposure of the drug over the time. So A has 400, B has 600. So you can check, which one is the better. So 600 has a more area under curve. Time to reach the Cmax is called Tmax. So the time taken to reach the maximum blood concentration, A drug has 2 hours, B drug has 1 hour. So within the less time the drug is reaching means drug B has a more efficient. Half-life, nothing but time for the blood drug concentration to reduce by half of its, A drug has 4 hours, B drug has 6 hours. Clearance rate, speed at which body removes the drug. Drug A clears faster than the drug B. Like that we can check. And pharmacokinetic, biomarker, drug interaction related endpoints are volume of distribution, how much a drug spreads into the body tissue. Drug A stay mostly in the blood, drug B spread into fat tissues widely. Okay. So volume of distribution, how much drug are spread into the body tissue. This is also one type of endpoint. And receptor occupancy, how much percentage of target receptor that the drug bind to the receptor. Drug A binds 70% cancer receptor, drug B bind 90%. So drug B has a more effective. Biomarker changes. Changes in the biological marker like PSA or HB1AC like markers are there that changes how it happen. So PSA tumor marker dropped 60% with the drug A and 80% with the drug B. Drug interaction endpoint. How one drug affect the another drug action. So example antibiotic reduce the blood level of anti-seizure drug. Dose limiting toxicity, highest dose before serve side effect stop further increasing. For example, paracetamol 500 mg. That will give a more efficient result. So that is why that is the highest dose they will consider. Okay, like that we have to check which dose has a maximum dose limiting toxicity. Okay, so patient reported outcomes related studies endpoints are quality of life, overall happiness, daily comfort, mental peace. So these were the questionnaires related. So they will ask some question based upon the answers provided by the subject. They will calculate the count and they will show the how the quality of the life. Drug A report, for example, 30% more compared to the drug B, like that. Symptom severity, how severe symptoms like pain, nausea, etc. will come. Functional ability, how the ability to do the normal activities. some neurology related studies. So functional ability also taken as considered as an endpoint because can't walk or eat or this thing. Those functions also they maintain difficulty. Okay, so which drug is maintaining less efforts. Time to symptom worsening. Time before symptoms worsening after the treatment. Okay, so treatment satisfaction. Patient is happy with the convenient with the therapy. Sometimes this also may affect the endpoints. So mental and physical related, function related endpoints. So sleep quality, anxiety, depression, conjunctive function, daily living score, work impairment. So these are the endpoints you can also see in the mental and physical function related studies. In case of cost and healthcare use also some studies they do, and the endpoints is cost effective. Some drug has same treatment but cost is low. Okay, healthcare utilization, how the medical services are used, hospital or ICU or ER, etc. Day of work or school, number of sick leaves a day. So this is also one endpoint. Some studies, not only clinical, some other also having this day of school, workload, etc. Readmission rate, how many percentage are needed? Again, readmission, treatment cost. Okay, and financial and adherence endpoints. Medication adherence, how well patients follow the drug schedule. Out of pocket cost, money spent by the patient directly, not covered by the insurance. Disability incidence, new disabilities due to the treatment. Preventive care cost, how increases case of preventive measures, vaccines and tests, etc. Insurance claim data. So these are also endpoints. So final expanded endpoints are overall health outcomes, emergency visit reductions, and treatment compliance. This is also compliance also one endpoint. So how the following correct timings, doses, intervals, and whether how much percentages of compliance was happening by taking the drug. Long-term safety monitoring, monitoring the patient after long after side effects. Patient reported global health. So patient own rating their health improvement. So these are the general 50 clinical endpoints we are widely using. So other also there, but these are the mostly we use the clinical endpoint. So whenever you have used some oncology related studies, so that time the efficacy parameters most widely overall survival progression, etc. If you have any safety related studies, so these are the general using of endpoints of your study. So, if you are doing any study, first you can know what is our endpoint, what is our primary objective, how we are going to achieve. By seeing the result, what we are going to analyze. Okay? Yeah. So, if you want more like these videos, please subscribe my channel.